It is saying, I think the best way to repeal Obamacare is to have an alternative. Could you please tell me what that alternative would look like and how you would ensure that low-income children and their parents here in New Hampshire do not lose access to the care they currently receive?
Great question. And the way I think politically, just being against something, you run out of gas at some point. I mean, I think people generally know that Republicans are against Obamacare. There are a lot of good reasons why that's the case. But we have to be for things if we're going to be successful, if we're going to govern, if we're going to lead. My belief is, first of all, as it relates to protecting those near or at the poverty level, we have existing programs that have nothing to do with Obamacare. S-chip programs, Florida they call them Kid Care. We protected those programs, and they're important for low-income families. And a Medicaid program could be a catalyst for improved health as well. But unfortunately, Obamacare doesn't reform Medicaid. It basically keeps this system that is broken. I think what we ought to be doing is shifting these programs back to the states, creating a certain amount of criteria around them, and then allowing them to innovate to be able to create better outcomes and more focus. In Florida, we did this with Empowered Care, it was called, for Medicaid. And we gave choices for low-income people in their Medicaid programs. We gave them counseling. We allowed them to pick the plan that best met the needs of their families. We actually created a higher premium for those that had acute illnesses and a lower premium for those that were healthy. And the net result was that we lowered costs and we got better care. As it relates to the broader Obamacare issue, I think the exchanges, without all the mandates, is not a bad thing. In fact, it was a conservative entity, the Heritage Foundation, that proposed this a long time ago. But we shouldn't have employer mandates, employee mandates, all of the mandated benefits that create these extraordinary costs. People ought to be able to have choices. I think ultimately we need to move to a consumer-directed model for health care, where you have low premiums, high deductibles, where businesses and government, wherever appropriate, provides premium support, where you have catastrophic coverage. So in effect, what you're saying as a society is if someone has a life-changing illness, their family won't be devastated for a long, long while. Give people that peace of mind, but then give them choices and focus on preventing disease more than just reacting to disease, because it's so extraordinarily expensive what we have now. And I think we can do that. The other thing I'd say is that embrace the technology in our midst. You know, I'm so proud of my little iWatch. I haven't been able to figure out how to use it yet. But I know for a fact that 5 years from now, that these kind of devices can be used to monitor your health, to send wireless messages to make sure that if you're not taking your medicine right, that your health care provider knows or your caregiver knows, making life simple, to empower people to actually take control of their own health. Ultimately, that's what we need to do. And if we do that, I think we can lower costs and improve quality.